Hello, welcome once again to another exciting edition of Hematology and Blood Transfusion Science lecture series. This is a YouTube channel where we discuss different topics in hematology. Thank you very much for your support so far. You've been amazing. Guess what? We've reached 1,000 subscribers and it is all due to your support. Thank you. Thank you for liking our videos. Thank you for sending in your comments and your feedback and your questions. Keep sending it on the comment section. But for any reason you don't want to send your comment on the comment section, please use our email, which is scholarlywoman20@gmail.com. We had a lecture on antibody screening and we promised to continue with that lecture. Today is that day. We are going to be treating another exciting topic, antibody identification. Trust me, you are going to have an exciting time and you are going to learn a lot. Please, if you have not subscribed to our channel, this is the time to hit the button now. Remember to like our videos, share it, and also send in your comment and your question. Let me go straight to today's lecture. Permit me to share my slides with you. Thank you. My name is Dr. Ifeyinwa Mary-Ann Okafor, a lecturer in the Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, College of Medical Sciences, University of Calabar, Nigeria. Today, we are handling antibody identification. An alloantibody investigation procedure on a sample comprises of two distinct parts. The first one is antibody screening, and the second one is antibody identification. We handled antibody screening in the past. Please do well to get that lecture on antibody screening. I titled it Antibody Detection, Screening, and Identification. Listen to the lecture, and I believe it's going to help you a lot and also help you better to understand what we are doing today more. Recall that when we were treating antibody screen, if you had listened to that lecture, we said that antibody screen use 2 or 3 screening cells to dictate if antibodies are present in a serum. If antibodies are detected, they must be identified. Hence, the second part of this investigation, which is what? Antibody identification. When you do the first part of antibody detection, which is the antibody screening, any sample that has a positive antibody screen must undergo further investigation. And this further investigation is done to do what? Number 1, to identify the antibody present. Number 2, to assess the clinical significance of this antibody. Number 3, to determine the titer of the antibody. So if you do antibody screening and you have a positive outcome in any of the either 2 or 3 sets of cells that you use, then there must be further investigation. And this further investigation is what we call what? Antibody identification. Okay? Then what are the reasons for antibody identification? Why do we go further to do antibody identification after doing antibody screening? Number 1 reason why we do antibody identification is to do what? To identify the antibody that we have detected in the part 1 of this investigation, which is antibody screening test. Number 2 reason is to determine the clinical importance of these antibodies. To determine the clinical importance of these what? Antibodies. Number 3 is to ensure availability of compatible units of blood components for transfusion. And number 4 is it aids in proper management of hemolytic disease of the fetus and newborn. Okay, these are the reasons why we do what? Antibody identification. Note, it's important that you know that a clinically significant antibody can be defined as one that is capable of causing accelerated destruction of a significant proportion of transfused cells, or one capable of crossing the placenta and causing hemolytic disease of the fetus and the newborn. Remember also that in blood transfusion, what we normally do in blood transfusion science is what? We test the knowns with the unknowns. In antibody identification, what we are doing is we have the patient's serum, which is unknown, and then we are going to come with a group of cells, red blood cells, that contain known antigens, and then we are going to use it to identify the antibody inside the patient's serum. So the unknown is the patient's serum, while the known is the reagent red blood cell that we are going to use for the identification. Antibody identification, what do I need? Obviously, you need your patient's details, the age, the date of birth. You need the gender of your patient, the obstetric history of your patient. You need the ethnic origin. Remember, blood groups are geographically distributed. So you need the ethnic origin of the patient. You need the diagnosis, clinical condition, and drugs, if any, of the patient. You also requesting hospital and clinician must be known. Investigation required must be clearly spelled out. And then cell panel should also be known. And then patient's blood sample, well labeled, must be presented. And then SOP and guidelines should be there. Antigram. For an antibody to be identified, red cells carrying the corresponding antigen must be available. These red cells, or the reagent red blood cells, they come in two forms. The screening cells, or what we call the selectogen. These ones are the ones we use in the first part of antibody investigation, which is the screening test. Then the second one is cell panel. This is specifically used for antibody identification. The screening cells and cell panel, they contain several known antigens that are generally present in the population, as well as low-frequent antigens. Your screening cell, your cell panel, they are made up of known antigens that are generally present in the population. They can be commercially procured with lot numbers and expiring dates, but you can also prepare them locally from members of the staff in your organization, in your office, and then you can store them frozen in glycerol. The commercially prepared one come with the expiring dates and the lot number, and also the antigram sheet. Remember, just as I said when we are discussing antibody detection, screening, the screening and panel of cells must be selected from group O individual. The screening and panel of cells must be selected from group O individual. And this is done, to make sure that any positive results will not be attributed to ABO antibodies, such as anti-A, anti-B, or anti-AB. The screening of panel cells that you procure commercially, just as I said earlier, comes with a sheet of paper called the antigram. And this antigram contains the list of cells present in the vial. Just as is noted here, plus sign tells you the antigens that are present in that particular vial, while the zero signs tells you the antigens that are absent in the vial. The screening cells and panel cells are the same with minor differences. These cells are commercially or locally prepared group O cell suspensions obtained from individual donors that are phenotyped for the most commonly encountered and clinically important red cell antigens. The screening cells are just 2 or 3 donors, not pooled. They are made from 2 or 3 donors, not pooled. And the screening cells cannot be more than 2 or 3 sets. While cell panel is specifically used for antibody identification, that is, panel cells are used for antibody identification, and it contains at least 9 vials per set. The antibody identification panel cells is gotten from at least 9 to 15 individual identification cells, and these cells 9 to 15, so it could be 9, it could be 10 as a set, it could be 11, it could be 12, it could be 13, 14, 15 as a set. They are provided as a set and must be group O. They must be group O, and they are from different individuals, that is from individual donors. Remember, this individual must be group O, and the reason is that so that the antibody that you may isolate from this test will not be attributed to ABO antibodies, that is antibodies in ABO blood group system. And they must be fully phenotyped for all antigens that have clinically significant antibodies. It is also important to have cells with some antigens present in double dose. Example, NN, JKA, JKB, because these antigens have what we call dosage effect. And when you don't have them in double dose, it becomes very difficult to eliminate them or to identify them in heterozygous state. Let us do some reflection. Can you just ponder and think? If you are to prepare your cell panel locally, can you think of the antigens that must be on your cell panels? Can you think of the antigens that must be on your cell panel? Remember I said, this is our cell panel can be prepared. You can procure them commercially. You can also prepare them locally. Let's assume that you want to prepare them locally. Reflect, can you just think of what are those antigens that you consider that have their antibodies clinically important enough to be on this particular, on your red blood cells that you're going to use as to prepare your cell panel. I know you have something in your mind now. You can write them down. Let's go. Your cell panel must contain all the antigens that has clinically important antibodies. The antigens such as the antigens of Rh blood group system. We have the big D, the big C, the big E, the little c, the little e. And antigens in MNS blood group system, the M, the N, big S, little s, antigens in P blood group system, and antigens in Ley's blood group system, Kell blood group system, Duffy blood group system, Kidd blood group system. They must be present, and at times you can also have low frequency antigens. You can have Lutran, Diego, and others being present too. Antibody identification cell panel. Like I said, this is an antigram shown here. This antigram tells us exactly what is inside the vial, the cell panel that we are using. And not only that, this antigram also helps us to score our reaction as we go along doing the test. At least we have, you see this part of the antigram contains a list of different antigens listed here. And then we have the cell panel, the panel number 1, panel number 2, 3, 4, 5, 6, 7, 8, 9, 10. So this particular antigram is having as a set 10 different panel of cells. They were all obtained from group O individuals. Now, this line tells you the antigens that are present in the cell panel number 1 and the ones that are absent. And this one, remember we said plus sign tells you what is present and 0 tells you what is absent. And then this side of the antigram will help you to label your reaction as you go along, as you do the test. The immediate spin, the 37 degrees Celsius, and anti-human globulin stage. Okay? Remember I said that each of the panel cells has been antigen typed as shown on the antigram. The plus sign refers to the presence of the antigen. The 0 refers to the absence of the antigen. Now let us look at cell panel number 10, for example. It tells us that this particular cell panel contains antigens that are present in this particular cell panel. You have about 9 antigens in this particular cell panel, and they are little c, little e, F. That's the antigens in RH blood group system. And we have the M, have the little s, Lewis B, little k, Duffy A, and key JKA. Okay, so we have about 9 different antigens in the panel cell number 10. Okay, and again, your antigram also contains another place where you record the results of your auto control. Remember, you cannot do your antibody identification without including auto control. Auto control should be run with all the panels. So at this level, where you say patient typing is a place where you record the reaction that you obtain in your auto control. Auto control means simply reacting the patient's red blood cell with the patient's serum. These tests are carried out at room temperature to detect cold complete antibodies like anti-M, anti-N, anti-Lewis A, anti-Lewis B, Lutran B, and autoantibodies like anti-I, anti-IH, and anti-H. Tests at 37 degrees Celsius detect warm complete antibodies. Example, IgG and complement binding IgM and IgG antibodies. Then at AHE stage, anti-human globulin test acts as a backup test to detect warm reacting and IgG or complement binding alloantibodies, which are most times clinically significant antibodies. Also enhances the reaction of certain antibodies like antibodies of RH, Lewis, and Kidd blood group system. We also have enhancement reagents. These enhancement reagents are solutions added to serum or cells or cell serum mixtures to promote antigen-antibody binding or agglutination. The enhancement reagents include low ionic strength saline, LIS, bovine albumin, and enzymes. LIS, that is low ionic strength saline, increases the rate of antibody binding to antigens, while albumin reduces zeta potential. Enzymes enhance reactivity of certain antibodies. like Rh antibodies, KID, P1 antibodies, Lewis, and I. But the same enzyme destroys or depresses the reactivity of antigens. That is antigen in Duffy blood group system and MNS blood group system are destroyed by enzyme treatment. Like I said earlier, these tests are done at room temperature, 37 degrees Celsius, and anti-human globulin stage. Now, this room temperature stage can also be said to be immediate spin. And then we have the 37 degrees Celsius stage, and then anti-human globulin stage. Antibody identification testing. Now, you have your cell panel. Let's assume you have 10 cell panel or 10 panel of cells, different vials gotten from 10 different individuals with the antigram well labeled, telling you exactly what is inside those vials. Then what you are going to do is to arrange your tubes in this manner. As you arrange your tubes in this manner, you now have to put a drop of each of these panel cells into these tubes. So which means that cell panel number 1 should go into tube labeled 1. Cell panel number 2 should go into the tube labeled 2. Cell panel number 3 should go into the tube labeled 3. A drop of cell panel number 4 should go into the tube labeled 4. As just continue like that until you get to tube number 10. Then at tube number 11 is what we call auto control. You add the patient's red cell there, the patient's red cell. The same thing, you now get the patient's serum. The 2 drops of patient's serum is now added in each of the tubes, each of the tubes. And then you also add the same in your auto control. And then you now go straight. The first phase is what we call the immediate spin. The immediate spin, perform immediate spin, and then grade your agglutination. You also remember that you can also have hemolysis. Some antibodies can cause hemolysis. Perform immediate spin and do what? Check for agglutination and also inspect for hemolysis. Record the result in appropriate space as shown. So you spin and then you record the result. Immediate spin, we have the first tube, that is agglutination there, 2 pluses. Second tube, there is no agglutination. Third tube, there is no agglutination. And you do the same until you get to the last tube. The next thing is you have to incubate at 37 degrees Celsius. Now, at this stage, you can add you can have one of your enhancement reagents here, if you like, depending on what is obtainable in your laboratory. One of the enhancement reagent you can add at this stage is low ionic strength saline, okay? And then incubate for about 10 to 15 minutes at 37 degrees Celsius, and then check for agglutination. From this testing that we're doing, at 37 degrees, the first panel, no reaction. The second panel, no reaction at 37 degrees Celsius. The third panel, no reaction. So the third panel, no reaction, and you continue like that until you get to the last panel, cell panel. Now, you have the AHG phase. That is the indirect antiglobulin test phase. So what do? You wash your cells 3 times. You wash your cells 3 times, and then you add your AHG again, and then you will incubate for a few minutes, and then you check for agglutination again, just like you did in the other phase. And then from what we are doing here, you have at cell panel number 1, no reaction. Cell panel number 2, no reaction. Cell panel number 3, no reaction. The same goes down to the last panel. Remember, whatever you do to your cell panel, you also do to your auto control. Now, because our AHG they are all negative, we must not forget to add our check cells. Remember, the check cells serves as an auto control for your AHG, partially sensitized cells that must react positive with the anti-human globulin reagent. Okay, so we check out, we add our check cells, and then we continue. Now, looking at our antigram, we have our reaction. Looking at it, we can say where we have agglutination. At immediate spin stage, we have agglutination at about 4 different cell panels. At 37 degrees Celsius, there is no agglutination. At AHG level, there is no agglutination. Already, I'm sure at this stage, you're already having an idea in your mind of the nature of the antibody that may be causing this particular reaction. Remember, for you to understand antibody identification very well, you must know the reactivity of various antibodies. We can see straight away that we have agglutination only at immediate spin. That will prompt us to think that the antibody that is causing this nuisance here will most likely be what? Cold antibody, because at 37 degrees Celsius, there is no reaction. At AHG level, there is no reaction. We are seeing here that we are having what? Reactions at immediate spin, at cell panel number 1, cell panel number 4, cell panel number 7, and cell panel number 9. Okay, they're giving us what? Reaction. And the reaction is consistent, 2 pluses. Okay, how do we now identify the antibody that is actually causing the reaction? Looking at our antigram, there are different rules to interpreting these results. There are a few basic steps that we must know. We must follow it when interpreting results. If we follow these steps, if we try and understand these steps, it will help us to do what? To interpret and be able to identify the antibody that is actually causing the reaction. Rule number 1, the first step is what we call ruling out. Ruling out. This means crossing out antigens that did not react. Crossing out antigens that did not react. The second rule says circle the antigens that are not crossed out. Circle the antigens that are not crossed out. And then the third one says consider antibody usual reactivity. Consider antibody usual reactivity. And then the last one, or not the least, says look for a matching pattern. So we're going to take these rules step by step and see how it can help us to interpret what we have done in the result that we have in our antigram. Let's go. But before that, you should remember that an antibody will only react with cells that have the corresponding antigen. That is normal and standard rule. And also, antibodies will not react with cells that do not have the antigen. It's important that you have this in your mind. It will enable you to understand what we are trying to explain here better. And you also need to know that apart from agglutination, certain antibodies are known to cause in vitro hemolysis. Example, you can have anti-lase A, anti-lase B, anti-P, and anti-Val. They can also cause hemolysis instead of agglutination. So as you are looking out for agglutination, also watch out for hemolysis. Ruling out. The first rule in ruling out is that you are going to consider the cell panels that are negative at all the phases of your test. The three different phases of test, that is immediate spin, 37 degrees Celsius, and AHG. You have to look at the cell panels, those that are actually negative, where you don't have any reaction. So looking at this particular antigram now, we have cell number 2. There's no reaction at any phase. Cell number 3, there's no reaction at any phase. And then cell number 5, there's no reaction at any phase. Cell number 6, there is no reaction. Cell number 7, we have a reaction, so we'll leave it alone for now. Then cell number 8, there is no reaction. Cell number 9, there's a reaction, we'll leave that. And then cell number 10 and 11, there is no reaction. So these places where you don't have any reaction at any phase is where you'll start your ruling out from. So what do? Let's start with cell panel number 2. So you start, and then in ruling out, that the basic things you need to consider. First of all, you need to bear in mind the antigens that are homozygous and the antigens that are heterozygous. Now, the antigens that are homozygous can easily cross out, but antigens that are heterozygous, you don't cross them out at that state of heterozygous, but you can only cross them out when they are in homozygous form. Let us look at what we have here. Cell panel number 2, we have D. D always occurs in homozygous because, as you know, there's no antithetical D. So you can cross that out here. C, big C, actually have antithetical little c. Little c here is 0. So this C here is homozygous. The big C here is homozygous. Assuming that we have little c in any of this, that is called that means it's in a heterozygous form here, then we can't cross it out. But because it is in homozygous form, we can confidently cross it out. Okay? Now, here we have little e. Little e here is also in homozygous form because the big E here is 0. Therefore, we can confidently cross this out. Remember, we're considering cell panel number 2. The F is 0 here, so we leave that alone. Now we have M and N. M is in heterozygous form here because N is positive. So we circle it. We cannot cross them out at this level, okay? Because they are in heterozygous form. The N is in heterozygous form. S is 0 here, so we leave it for now. Little s can be crossed out because it is appearing here in homozygous form. It is appearing here in homozygous form because this big S here is 0. So we cross that out. The P, of course, can be crossed out. The lowest A is 0 here. So the lowest B can be crossed out because the lowest A is 0. So this is homozygous form. And then big K is 0 here. So we leave that for now. And then little k can be crossed out. And then Duffy A and Duffy B. The Duffy A is 0, so Duffy B can be crossed out. Because the JKA is present and JKB is 0, the JKA can be crossed out. Remember, we are considering only the two that have negative what? Reactivity at all the stages of the reaction, the immediate spin, 37 degrees, and AHG. Then tube number 3, you do the same. The D is already crossed out there. The big C is already crossed out, and then the E is not yet crossed out. Remember, and then the little c, no, and then the little e is already crossed out. And then let us see here. We can now cross out here as the cell panel number 3. The big M is appearing as homozygous here because the N is absent. Because of that, we can confidently cross out M here at this level, okay? Remaining N. At big S, here, the big S is present, and then, but we cannot cross out big S. Remember, at this level, we have crossed out the little s because it is in homozygous form. But here, we cannot cross out big S because it is appearing in heterozygous form because little s is present. So we circle it. Maybe when we consider other cells, we can cross them out at that level. So we move. We already crossed out B1, and then layers have not been crossed out because it is 0 here. And then layers B is already crossed out here. And then K, we can cross out confidently here because K is not present in the cell that reacted, so we can cross it out here. And then remember, we've already crossed out little k here. And here, we're having Duffy A and Duffy B present. So remember, we've already crossed out the Duffy B here, but we cannot cross out the Duffy A here because it is appearing in heterozygous form. We cannot cross out the Duffy A here because the Duffy B is present. So this is heterozygous state. So we can't cross the Duffy A here. So we move, we circulate and move. And then here we can confidently cross out JKB because it is appearing as a homozygous. It is appearing as a homozygous here. The JKB is the JKA is 0 here. The JKB is positive. That means it's appearing as homozygous here, so we can confidently cross it out. So we are done with tube A, second tube and third tube. So the next tube that is negative is what? Tube number 5. There is no D here. There is no C, but E is present. But we cannot cross out E here because the E is appearing as heterozygous here in panel number 5. The E is present, and then little e is also present. So we cannot cross out big E here because of the presence of this little e here, okay? And little c is already crossed out before. And the N can be crossed out at this level because it is appearing as homozygous here. If you look very well in cell panel number 5, N here is appearing homozygous. In cell panel number 5, there is no M, it is only N. That means this particular individual obtained N gene from the father and also got the N gene from the mother and is appearing as a homozygous here. Then we'll move. The next is big S. Big S can be crossed out at this level because it's appearing as a homozygous. It's appearing as a homozygous. There's no little s here, so we can confidently cross out big S. And then we'll move. The P is already crossed out before. The layers B, we can always cross out here because here we can see that layers A is negative, is 0 here. So layers B is appearing alone, so we can confidently cross it out at this level. And that means the antibody we are suspecting definitely cannot be layers B. We have little k, which is already crossed out before. And then we have Duffy A, which we can confidently cross out here because it's appearing as a homozygous here. If you check very well, you can see that Duffy B here is 0, therefore it can be crossed out. Now remember, we have crossed out we have crossed out JKB here, but here we cannot, excuse me, but here we cannot cross out JKA because JKB is also present. So it's appearing as a heterozygous state here, so we can't cross it out. Let's see what happens down. Another cell panel that is negative is cell panel number 8. We have, in this cell panel number 8, there is no D, big D, there is no big C, there is no big E. The little c is already crossed out. The little e is already crossed out. The f is already crossed out. And then the m, we've already crossed out m somewhere up, even though we've already crossed it out where it is in homozygous form, okay? N, we cannot cross out here. We've already crossed n out here where it is in homozygous form, okay? Now, the little s is already been crossed out where it is in homozygous form. And then the p is already crossed out. And then the k is already crossed out. The little k is crossed out. The jka, it can confidently cross out here. The jka, we can confidently cross out here because it is in homozygous form. See, the jkb here is 0. So that means this individual that gave us his blood sample to prepare the cell panel number 8, obtain the gene for JKA from the mother, and also obtain the gene for JKA from the father. That's why he's having it in double dose here. So we can confidently cross it out here. And then we'll now go to another negative panel of cells. That is the panel number 9. And then we'll do the same crossing out for every other thing. And then when we finish, we do the same for panel number 10, and then we do the same for panel number 11. Remember, the last is what? The auto control that contains the patient serum and the patient's red blood cell. So we say at this stage, ruling out is what? You cross out antigens that show no reaction in any phase. Do not cross out heterozygous antigen that show dosage, just like we have just done. So as we have crossed all these cells out now, as we have crossed out these cells out, which we've done at the stage of ruling out, we will now circle the antigens that are not crossed out. Okay, remember in all the things that we are doing, we couldn't find, we were not able to cross out the E antigen because the E antigens were all appearing in a heterozygous state. We couldn't find a place where E appeared in homozygous form, so we couldn't cross it out, okay? And then we were not able to cross out the Lewis A. We were able to cross out Lewis B, but Lewis A, we were not able to cross out because it is present in the where exactly on the cell panel that actually reacted, but absent on the cell panel that did not react. The E antigen is actually present on the cell panel that did not react. But the problem why we did not cross it out is because in all the cell panels, it appeared in heterozygous state. Remember, you don't cross out antigens that are appeared in heterozygous state because the antibodies might be too weak to react at this stage. But when you cross it out, you might end up having a wrong negative result, or end up identifying wrong antibody, okay? Or eliminating something that you should have identified. So here, we circle antigens that are not crossed out. So the two basic antigens that are not actually crossed out is the antigen E and then antigen Lewis A. Those two antigens were not crossed out. So what do we do next? Now, the next thing is rule number 3. Consider antibodies' usual reactivity. So we're going to take into consideration the reactivity of antibodies to these particular antigens. That is anti-big E and anti-leucine A. So normally the antibodies in Rh blood group system are mostly warm antibodies. They react optimally at 37 degrees Celsius and even more at AHG level. And here we are at 37 degrees Celsius. We don't have any reaction. At AHG level, we don't have any reaction. So definitely, the antibody that is causing this reaction cannot be what? Anti-E. It cannot be antibody in Rh blood group system. Then let us look at antibody in Leyes blood group system. The antibody in Leyes blood group system are mostly cold reacting antibodies. They are mostly IgM antibodies. They react well at room temperature. And this is it. This is it. We have gotten our culprit. That means our reaction, we have our reaction, this antibody reacts well at immediate spin, not only at cell panel number 1, but in 4 different cell panels, and the reactivity is actually consistent. So looking at what we have here, we can confidently say that this antibody is actually what? Anti-Leyes. But we cannot conclude, but at least we are forming an opinion now. We definitely know where we are going. So we said here that Leyes A antibody is normally a cold reacting antibody, that is IgM. So it makes sense that we see the reaction in the immediate spin phase of testing as being caused by Leyes A, which is only one that is not crossed out here, apart from the E. The E anti-E antigen is a warm reacting antibody. And since we have the 37 degrees phase negative and AHG negative, at least we are sure, we are almost sure that Leyes A antibody is the culprit here. Isn't that interesting? I hope you are following what we are doing. If you are confused, don't worry. We are going to look at it in more details and you will understand better. Okay? Now, what are we going to do next? What we are going to do next is to look at the matching pattern. We look at the matching pattern. Yes, there is a matching pattern. As you can see here, there is a matching pattern. Okay? So, we have gotten our antibody that is actually causing the reaction. The antibody is anti-Leyes A. Okay? Now, there are things you also need to consider. It is important to look at the autocontrol. Okay? When you are doing antibody identification, you look at the autocontrol. Now, the autocontrol, if autocontrol is negative, that means in your mind, what you should know that should be causing the reaction, it should be an allo antibody. But if autocontrol is positive, then you'll be looking at auto antibodies. Okay? And also delayed transfusion reaction that could be as a result of allo antibodies. Okay? Then in phases, you look at immediate spin. If there's a reaction at immediate spin, you'll be looking at, you should know that the culprit is most likely going to be cold antibody and an IgM antibody. If there's a reaction in 37 degrees phase, you'll be looking at cold antibody that has a higher thermal range, or warm reacting antibody. And at AHG phase, definitely is warm antibody or IgG antibody that is actually significant. Now, another thing that you can also consider is the reaction strength. If you have one consistent strength, that an example is what this one we just finished now. We have one consistent strength, 2 plus here, 2 plus in here, 2 plus here, 2 plus here, 2 plus here. Then you can now start thinking that it's only a single antibody that is involved here. But if you have different strengths, That means you can think of different antibodies, or it might be as a result of dosage effects. Okay? If panel cells are homozygous, just as what we do when we are ruling out, a strong reaction may be seen. If panel cells are heterozygous, reaction may be weak or even non-reactive. And this is one of the reasons why we don't, when we are using our ruling out rule, we don't rule out cells that are in heterozygous. We must find them in homozygous form before we rule them out for better results. Matching pattern. Matching pattern. Single antibodies usually show a matching pattern that matches the one of the antigens. Just like is shown in the previous example that we just finished. And then if it is multiple antibodies that are involved in the reaction, it is actually more difficult to match because they often show mixed reaction. One might be strong, one might be weak, okay? Now, there's also another thing to consider when interpreting your results in this antibody identification. We also talk of that what we call rule of three. The rule of three must be met to confirm the presence of the antibody. This rule of three must be met to confirm the presence of the antibody. That is, a p-value less than 0.05 must be observed. This gives at least 95% confidence interval. And how is this thing demonstrated? Patient serum must be positive with 3 cells with the antigen and must be negative with 3 cells without the antigen. Okay, let's look at our example. There's our example that we just finished here. It's actually met with this rule of 3. It says here, cell panel number 1, 4, and 7 are positive for the antigen and gave a reaction at immediate spin, just as is shown here. While cell panel at number 8, 10, and 11 are negative for the antigen and did not give a reaction at immediate spin. That is wonderful. This particular case actually met with the rule of, fulfilled the rule of 3. But it might not be like that in all cases. What if the rule of 3 is not fulfilled? What happens? Patient serum must react with at least 2 cells positive for its corresponding antigen. At least 2 cells positive for its corresponding antigen must be reactive. And then patient serum does not react with at least 2 cells that are negative for that particular antigen. If there are not enough cells in the panel to fulfill the rule, then additional cells from another panel could be used. The final step in antibody identification is to do what? To phenotype the patient's red cells. To phenotype the patient's red cells. What is phenotyping? How do we go about doing this? In addition to the rule of 3, antigen typing the patient red cells can also confirm an antibody. How is this done? That is, when you have finished identifying your antigen, just like we have just done, we can all just do this to check if our answer is actually correct. This antibody that we have just identified, does it fulfill the rule of 3? Did it react with 3 cell panel that actually contain the corresponding antigen? Did it not react? Is it negative for the 3 cell panel that actually will tell the antigen? If it fulfills the rule of 3, you can also do phenotyping. Remember that you can only do this if the patient has not been transfused, because if the patient is transfused, you may have the transfused, the donor cell actually reacting also. Phenotyping the patient's red blood cells. For example, we have isolated Lewis A in this particular patient now. Now, what do we do to confirm if actually this is actually Lewis A? We phenotype the patient. Now, what do? We get anti-Lewis A, anti-sera, anti-Lewis A, anti-sera, and then we get the patient red blood cells. We react the anti-Lewis A, anti-sera with the patient red blood cells. We expect, since a patient does not make antibody against its own antigen, the answer should come out negative, showing that this particular patient does not have Lewis A antigen. That is why he's able to make antibody against Lewis A. Then, what happens when we have multiple antibodies? Multiple antibodies may be more of a challenge than a single antibody. Why is this? Reaction strength can vary. Matching pattern can be difficult. Okay? But to enable us identify this multiple antibody in a patient's serum, there are certain things we can do. We can use several enhancement procedures. And this enhancement procedure can what we call selected cells, neutralization technique, chemical treatment of cells, use of proteolytic enzymes, sulfhydryl reagent, and ZZAP, which is ZAP. What are the selected cells? Selected cells are chosen from other panel or screening cells to confirm or eliminate the antibody. The cells are selected from other panels because of their characteristics. The number of selected cells needed depends on how many antibodies are identified. So if, for example, that we have identified 3 different antibodies, what do? We get selected cells and react them with these particular antibodies. If they come out positive, that means the antibody is actually present in the patient's serum. But if they come out negative, that means the antibody so identified may not be the case. For example, let's say you ran a panel and identified 3 different antibodies. That is anti-big S, anti-JKA, and anti-P1. The selected cells can help us to actually confirm the presence of these antibodies in the patient's serum. Now we have a panel of selected cells. The cell panel number 1 contains only the big S. When we react it at different phases, immediate spin, low ionic strength saline at 37, and then AHG, there's a reaction. It reacted at AHG level, confirming the presence of anti-big S in the patient's serum. The cell panel number 2, selected cell number 2, contains JKA antigen, which also reacted, while the selected cell number 3 did not actually, it was supposed to contain, the patient's antigen is supposed to contain anti-P1. So we use a cell that contains P antigen to react, but it came out negative. What this means is that the serum of the patient actually contains 2 antibodies and not 3. And these 2 antibodies are just anti-big S and anti-JKA. There is no anti-P1. So selected cells can help you identify multiple antibodies. Remember, we are discussing in a situation where we have multiple antibodies in the serum. What do? Selected cells can help you identify these antibodies, just like we have just done. Then you can also use neutralization technique. Neutralization technique, some antibodies may be neutralized as a way of confirmation. Commercial substances bind to the antibodies in the patient's serum, causing them to show no reaction when tested with the corresponding antigen in the panel. Common substances can use to cause neutralization. So what you do in this thing, you use this substance to neutralize the antigen so that by the time you react it, you don't actually see any reaction, telling you that the antigen has been neutralized or the antibody has been neutralized. Common substances is P1 substance, there is A and B substance, and then the I substance that can be found in breast milk, and SDA substance derived from the human or guinea pig urine. You should be aware that many of these substances neutralize cold antibodies. Cold antibodies can sometimes mask more clinically significant antibodies. An important reason to use neutralization technique to eliminate them so that you will be able to identify more clinically important antibodies. Another enhancement technique procedure that can use to identify multiple antibodies in a patient's serum is to treat with enzyme. Enzyme treatment can be used to enhance or destroy certain blood group antigens. Several enzymes exist. You have piscine, you have bromelain, you have peptide. Remember the enzyme function to remove the sialic acid from the red blood cell membrane, thus destroying it and allowing other antigens to be enhanced. Antigens that are destroyed by enzyme treatment are M, N, S, and little s. Then the antigens in Duffy blood group system are also destroyed by enzyme treatment. But the antigens that are enhanced by enzyme treatment are antigens in RH blood group system, antigens in KID blood group system, antigens in Lewis blood group system, I blood group system, and then P blood group system. Note that if there is no agglutination after treatment, then it is assumed that the enzyme had actually destroyed the antigen. Another enhancement reagent that I can use is sulfhydryl reagents. These cleave the disulfide bonds of the IgM molecules and help differentiate between IgM and IgG antibodies. They are good to use when you have both IgG and IgM antibodies. That is warm or cold antibody. You are suspecting the two. You are isolating the two from a patient sample. And then we have ZZAP, that is ZAP. This is a combination of proteolytic enzymes like fissin and papain and DTT. The nature care M, N, and S and Duffy antigens and other less frequent blood group antigens. They do not denature KX antigen, RH antigen, and KID antigens. They are good for absorption technique and freeze autoantibody of patient cell so that autoantibody can then be absorbed onto another red blood cell. Okay? There are some complications in identifying antibodies from this reaction pattern, which include variation in the strength of reaction, which you have said before, dosage effects. When you don't have no clear pattern that is discernible, it can be confusing. In that case, you can make use of any of these enhancement procedures to help you identify the antibody. And remember that accurate grading of reaction strength is very, very important, as it helps us to see varied reaction strength. Accurate grading, because if you look at the agglutination, you being able to grade the severity of the agglutination will help you to identify the reactivity of the antibodies as you try to interpret your results. So accurate grading of the reaction strength is very important, as it helps us to see varied reaction strength and helps us to interpret our results better. Okay? Thank you very much. I hope that you have learned a lot. I'm also very, very excited. I know that antibody identification can sometimes be a bit confusing. This is the first lecture. If I know that you have many questions at this stage, send in your questions to us. You can put it up at the comment sections, or you can use our email, scholarlywoman20@gmail.com. We will answer you promptly. If this is your first time of, having a lecture on antibody identification, don't be afraid. Just keep a date with us. In the next lecture, we are going to take up specific examples, and we're going to try to teach you in detail how to apply these principles, step-by-step principles of interpreting your results on the antigram, the ruling out, the circling out the one that is not reacting, and then matching pattern, how you go about interpreting your result and identifying your antibody. Just keep a date with us. The next lecture will help you to understand what we have done here better. Please remember, if you have not listened to antibody screening lecture that we have earlier, please do well to go and listen to that lecture, and then listen to this particular one again and keep a date with us. By the time we treat 1 or 2 or 3 examples, you will be able to comprehend better. Thank you very much for being part of what we are doing. Remember to subscribe to our channel, like our videos, send in your comments, and also share our videos. Thank you very much. Thank you and thank you.